And probably the last factor that I want to address would be in terms of the pathophysiology of these disorders is the prevalence of psychological distress. And the prevalence of depression, anxiety, and sleep disturbances in COVID-19 was analyzed in this meta-analysis of 31 studies with more than 5,100 patients. And it's possible that the virus produces depression, anxiety, and sleeping disturbances, and this is probably related to a lack of contact with families and loved ones during the quarantine or hospitalization, fear relating to the disease due to poor knowledge or misinformation regarding COVID-19 that we were having at the beginning, and feeling of self-blame and social stigma. So all of this together led us to propose this mechanism for post-COVID-19 disorders of gut-brain interaction that we published together with Dr. Uday Ghoshal from India and Giovanni Barbara from Italy, and we published this at the beginning of 2021 in the American Journal of Gastroenterology. So our theory was that the SARS-CoV-2 virus would bind to the ACE2 receptor in the gut epithelial cells. It will get internalized, and this effect would produce an increased epithelial permeability with an inflammatory response. And this inflammatory response could be measured with fecal calprotectin, as was showed by the other study that I showed, and correlated with the IL-6 levels systemically. In addition, there could be probably translocation of some bacterial components, and this biosis was also reported at that moment. So these inflammatory mediators would stimulate the enteric neurons that had projections to the central nervous system, together with an increased perception due to psychological distress, would probably be the perfect scenario to develop post-COVID-19 functional gastrointestinal disorders or disorders of gut-brain interaction. Of course, as with any post-infection disorder, we would expect that the majority of patients after COVID-19 would get a complete resolution.